The following is a local resident producers program. The program content is the sole responsibility of the producer and does not necessarily reflect the views or policies of Oshkosh Media, the City of Oshkosh, or your video service provider.
Hi everybody, welcome to another edition of On Oshkosh. I'm your host, Cheryl Hentz, and very pleased to be joined tonight by two folks from Reach Counseling. It's a counseling facility in northeast Wisconsin, and they do all kinds of counseling. We're going to find out just the depth and breadth of the services that they offer tonight. So to my right is Marianne Radley. She is the Advocacy Director and Volunteer Coordinator. And to my left is Kim Lavka. She's the Clinic Manager. And I think I saw on your website that you have another title too, don't you?
Well, I'm a therapist also.
Okay, so therapist and clinic manager. All right, good. And neither one of you has been here before, so welcome. I don't know how we didn't have you guys on years ago, because we've been doing this since 2002, with the exception of 1 year, but better late than never.
Right.
So
Yes.
welcome.
Thank you.
Appreciate both of you being here. So let's find out a little bit about what Reach Counseling is. Tell us a little history,
Sure.
if you will.
Yeah, so Reach Counseling is a sexual assault service providing agency as well as a licensed mental health clinic. So we provide several different services to the community. Counseling and sex offender treatment is on our counseling end of things. And then we also have a team of advocates who provide 24/7 crisis response for sexual assault survivors, as well as an education program in which our educators go out into the schools and talk to kids ages K through 12 about age-appropriate information related to abuse and consent and healthy relationships and all that stuff.
And do you, and I know we'll get into each specific program a little bit later, but when you go into schools, do you talk to them about trafficking? Because I know that's a big issue these days.
Yeah, we do, actually. I'm glad you brought that up. That is being incorporated into our education program, and actually one of my advocates is our specialized anti-trafficking advocate. So she works with that population, and along with another advocate, they've actually just been trained in a curriculum called Love 146, where it's a 5-week program. They're going to be going into some schools in the area and teaching a curriculum about the warning signs, about red flags, about what trafficking is, because it's pretty misunderstood. So
It's misunderstood, and people have the idea, because this is still a relatively safe community.
It
I
is.
think all of northeast Wisconsin is. And I think that people have this misconception as it is, that trafficking doesn't happen here.
absolutely.
You know,
Yeah.
it doesn't happen here, and it certainly isn't going to happen to my child, and there's that whole stigma that goes along with all of that. So when we get to that part of the program, you know, let's talk about some of that. So how did Reach Counseling get its start? How long has it been around?
We've been around since the mid-'70s. We started out as the Rape Crisis Center of Winnebago County, and we're a small, I believe, volunteer-run organization by a few women back then, and just kind of continued to grow since. In fact, Christine Ann Domestic Abuse Services split off from that organization and became their own entity in the early 80s.
Okay.
So we kind of started together and now have grown into much bigger separate entities in the community. So we've been under a few different names over the decades, but our core mission has always been to respond to sexual violence.
Sure. And you guys partner with them for
do.
Take Back the
Yes,
Night, which
yeah,
we're going
we
to talk
do.
about later on in the program. So excellent. Now, is there a charge for your services?
There's no charge for the services that Mary Ann was talking about with education and advocacy. for children ages 4 to 12, we have some grant funding that allows us to see those children who have been affected by violence, by sexual violence, physical violence, and witnessing domestic abuse. Those children can be seen for free. We don't charge the families anything for those services because we really want to help. We feel it's really important. We don't want there to be any barriers for the little kids getting some help.
Sure.
And ages 13 and up, we will take insurance. We can take most insurances. However, insurance, the ability to pay, we don't want that to be a factor. So if for some reason we don't take the insurance that the client has, or they just don't have insurance at all, we have some pretty low sliding fee scales that we can that we use. So we don't want it to be a barrier.
What about like, well, it used to be called Badger Care. I'm not sure what it's called now. Forward Health or something. You guys take that then too?
Absolutely.
Yeah, because that's a population that I'm sure is heavily impacted by some of these things.
Actually, I think that I would bet over half of the people that we work with have some form of Badger Care coverage. And I think that that is probably one of the things that makes us a little unique, is that a lot of clinics do limit how many Badger Care Medicaid clients they take, and we don't. Sure.
Okay. So let's start talking about some of the programs and services that you offer. I just pulled a list of things off your website, and I was so blown away by everything that you do. But it is all related to some kind of trauma brought about by a crime or something along those lines.
Interpersonal violence.
Yep.
Right.
Okay.
Everything we do, that our mission is to help people who've experienced traumatic events.
Okay. What about someone who comes back from service to our country, a military vet? That certainly is a traumatic situation. Do you provide services to them too?
If they were to reach out to us for some services, we would absolutely do that.
Okay, fantastic.
And actually, the Veterans Administration has been pretty willing to work with us on helping pay for those services when they choose to come to us.
Fantastic. Okay. I love it when I see agencies partnering and working together instead of one shoving them off to someone else, and then they get to that place and they send them to somewhere else, and by the time you're done, you've probably called 4 or 5 different places, and you're still right back to where you started from, at ground zero, and you haven't gotten any help at all, and you're just more frustrated, so that doesn't help. So I really commend you guys for working with these other agencies. So let's talk about the counseling program. So Kim, I guess we can talk to you about this.
Right.
So I'm going to read what's on your website.
Okay.
You offer short-term crisis counseling. You offer individual therapy, child and adolescent therapy, and then there are other things. There's one other thing under your adolescent therapy. So give us that's the overview. Let's take a look at, inside, and let's dissect these.
Right.
Yes.
You mentioned short-term crisis counseling, so I'll kind of start there. One of the things that's really important to it, unfortunately, there's a very high demand for our services, and sometimes we have a waiting list because it's important to us that when a client when we get them in, we want them to be seen regularly. We don't get them in and be so booked up that we can't see them for another 3 weeks or 4 weeks, because that's just not good service.
Right.
However, sometimes people call and they are in crisis. They are not okay. They're not safe. They're not functioning. So one of the things that we have a case manager who will meet with those people and help assess them. She'll help them with some debriefing or coping skills, see if she can do something to help them immediately in the moment. And if they, and she can do up to 3 sessions for free with them just to do that.
Okay.
And then from there, if she's not sure that they are going to be well, she gets in touch with me, and we find some way to help them. We don't make them wait if they're just not going to be safe waiting. But otherwise, she will do things. She'll help them come up with some safety plans. We have a few support groups. Sometimes she can help encourage those people to come and utilize the support group while they're waiting for a therapist. But our case manager, Corinne, does a lot of really amazing things, and she's very helpful to have because that way we can make sure that everybody who's really needing to be seen can at least get some crisis sessions right away.
Sure.
And in addition to that, her role also allows her to just to provide, if people are needing resources, they're needing to find, like they need help, like filling out an application for something, or so she will help our agency clients, advocacy or counseling, find the resources they need to make do.
Sure.
She recently helped a client of mine, contact financial aid at the university because she was having some problems figuring it out. And now my client is she's back in school.
And hopefully doing well,
right,
even though this is only
that
like
I'm
the
not sure
second week of school.
that I'm
or
not sure
something
she
like
would
that.
have been able to get back into school that quickly without the assistance that my case manager gave her.
Yeah. That's
So
wonderful.
So that's our crisis counseling. We do that we feel really good about that part of our program.
Okay.
And then what do we have?
Individual therapy. Mhm.
We do a lot of individual therapy. Like I said, the children, we have a child therapist who is her primary role is to work with the kids. So that's her specialty. The ages 4 to 12. And those are the children that, like, we don't charge anything for that. We see them for free, and we will see them as long as they need to be seen. So we don't have a time limit on, you only get this many sessions. You get as many sessions as you need to be well,
Okay.
to be at a spot. And she will also work with the family. So that's true for any of our therapists, that we will work with the family as well as the child, because we want this family that the child is going home to be well as well.
Sure.
So we do everything we can to help the family. So we have that, and we have adolescent therapy. So several of us see adolescents. Several of us are trained, are either trained or in training for to do an evidence-based treatment model with the children and the teens. It's called trauma-focused CBT. It has a really strong evidence base. I think there's there are probably around 30 studies that have really shown that it's effective. So it's really terrific. It's a structured model, and what we do is that the first part of the model is we want to give a lot of coping skills and education about what trauma is. And then once they're ready for that, then we do a trauma narrative and we help them process the trauma and desensitize. And then we bring a parent in, or a safe adult in, to kind of witness this narrative so they can be supportive of them after. And then we talk about how you're going to be safe and well in the future. And then we're done.
Yeah, and with the adolescents then, can they have as many sessions as they need also? Okay. Because, problems today, they're not simply solved like years ago when we were all younger. And there's so many layers of things that these kids are dealing with today.
Right. And that's true for the adults as well.
Yeah, that's true too.
I've been at Reach for 12 years, and I have a handful of clients I've probably been seeing 8 or 9 years, and just because that's how complex their trauma is, and that's how much help they need.
Yeah.
So, say we will see them as long as they need to be seen.
Okay. How are you guys funded? I know you get things from insurance, you get payments from them. Sliding scale fees, which I would venture to say you probably aren't getting a ton of money from that. Grants, do you get grant money?
Yes, we do. We receive a number of federal and state grants. We're also funded by the Oshkosh and Fox Cities United Ways. Oh, okay. As well as corporate grants, individual donors, fundraisers that we have, things like that. A lot of community support.
Okay. What's your annual budget like?
Oh gosh,
Great question.
Great question, but nobody knows the answer. We'll delve into that, and we'll find it.
Have to go higher up for that information.
Right, probably. Right.
Well, it's got to be. Well,
we've got a pretty big staff, so
we
it's
do.
up there.
I would say it's at least $500,000, probably.
Yeah, we can safely say that. Yeah, we've grown quite a bit over the years in terms of staff numbers. I think we're up to around 20 now.
Yeah, 20, 22, somewhere in there.
Kim and I first started a decade ago, it was maybe half that.
Yeah, it was probably about half that,
Yeah. Well, programming is not cheap.
No,
and,
correct.
And qualified staff to do that programming is not cheap.
Well, and thank God for agencies like yours, because, if clearly we've got a mental health problem in this country, whether it's from something traumatic related to a crime or it's from something else. But we've got mental health issues and everybody knows it. And if we would put more money into mental health programs and staffing, we probably wouldn't have half the problems that we do, you know. But the money is being spent on other things by people who make decisions that I'm not necessarily in favor of. So we'll just leave my political views there, probably safest. So let's talk about, was there anything else you wanted to say, Kim, about any of those therapy programs?
I don't think so, but like I said, that if you have, but we say one of the things, I think I have a really great team. I've got there's 5 people, we have 5 full-time people, and I've got some great people with some really great experiences, and they really do good work, especially with some of that really complex trauma.
Sure. Okay. Well, let's talk about your sex abuse treatment program. This is something that I think is interesting, but it's also needed.
Extremely needed.
Explain for us what that program is.
So our sex offender treatment program we do a number of different things. I mean, so we have some contracts where we're doing some things in the community. For example, we do have a sex offender group that we provide in the Oshkosh Correctional at the prison in Oshkosh here. Okay. So we go on site. You know, we have some staff who go on site and provide sex offender treatment there. Okay. Typically, we do sex offender treatment in groups because that's the standard. That's the best thing. That's best practice. And we have 2 people. I have 2 people on my team who are also part of the sex offender, who really are the core of the sex offender programming, okay. And they do really great work. But it is extremely important. We do a lot of accountability, but we also we want offenders to really understand why they committed the crime. We want them to understand their cycle. We want them to understand their risk factors, and we want them to come up with good safety plans. And then if that offender has a partner, is involved in a relationship, and particularly if there might be children involved, we also really say one of the things I do is I do some non-offending partner work. So I'll work with partners individually or in groups to help them understand sex offender dynamics and all those things I just talked about, the offender cycle, and how do you do a safety plan, and how do we keep people safe, and how do you help support your partner in a way that's like, how can you be part of your partner healing? Okay. How do you help hold your partner accountable and be part of his recovery as well? Okay.
So is the sex abuse treatment program different from the community-based sex offender treatment program?
No, I don't think so.
Okay, all right. Yeah. Because I saw both sort of listed on your site, and then for the community-based sex offender program, it said that was on hold right now.
It's on hold, but say that we're taking referrals. I mean, I think we have a few referrals, and once we have enough referrals, we're going to be doing a group.
Okay, all right,
the community-based groups will be up and running probably fairly soon, because I think we have a couple of people waiting. Yeah.
One of the things I learned from your site was that there are hundreds of sex offenders in Oshkosh, in this area. And I think that most people would be frightened by that. Mm-hmm. But when we say that there are hundreds here, are we talking about that they are all the ones who prey on young children or who rape people, or is that totally inclusive of even the 16 or 17-year-old kid who has sex with their 16 or 17-year-old girlfriend?
Right. Sometimes those are included on there. So I think I think those lists, like when you look at those lists, I think it's worth looking a little bit deeper. And the other thing is that these are the offenders we know about.
I was going to say, there's probably a lot more.
These offenders are ones that we are aware of. They're under supervision. They're being, they're in treatment. They're under supervision. There's somebody else involved. There are people watching them and oftentimes helping them through treatment.
Right.
So those are the ones we know about. I'm a little more concerned about the ones we don't know about.
Right. And those are quite often family members.
Absolutely.
Family member, family friend,
Absolutely.
a close family friend, whatever the case may be. And that's why I'm glad when the police department does a community notification that someone's being released into the community. I'm grateful for the sex offender list that shows where people are living. And yes, it can be a little scary unless you really know that this can encompass all kinds of sex offenders, including kids who just had sex with each other, and yet under our laws that makes them sex offenders.
Right.
And it's better to know where the people are than to not know where they are.
True.
So. Okay, let's see. One of the next things that I saw on your website was Connections for Family Safety, and
That's the non-offending partner group that I was talking
okay,
about.
all right, very good. So I'll draw that arrow up there.
Yep. Right. It's a fantastic group, and actually, and I really do. It's worth putting a plug out there for, because I don't know of any. Over the years I've been doing it, I don't know of any other program anywhere in the state that's doing this exact program. I've had people I've had people come from Plover, and I've had people come from drive an hour or two to get to us to do this program. It's just not really being offered anywhere else, and I'm not really sure why.
Sure. Are you getting any referrals from the drug court that we have in town?
Occasionally we do.
Okay,
yes.
but
Sometimes
it doesn't sound like it's that often.
Not super often, but yeah, but we have occasionally. Yes.
Okay, all right. First-time buyers education group. I had to look at that a little bit more closely.
About what that was about.
Yeah, and I very quickly saw what it was about.
Right.
But I even looked at it again just now, and I thought, wait, did I miss a word there? No, I didn't miss a word. That's what it is. Tell us what the first-time buyers education group is.
That's a group. Say that when a man, it's usually they're men, when they are picked up for soliciting prostitution, that they're given an opportunity to do this program instead of being prosecuted. It's a diversion. And if they do, I think I'm sorry, I can't remember if it's a 5 or 6 week group. But where they're taught a lot about the dynamics, they're taught about the impact of this. But it's a really cool program. The guys get a chance to understand how. We also talk about trafficking in there, because they need to understand that most of the women involved in prostitution are being trafficked. And they need to understand that. They need to understand how they're harming others. They need to understand the risks they're taking personally. They need to look at why are they seeking this out, and what should they do about it.
Sure. Do you know by chance what the recidivism rate is for something like that? Because maybe you don't, because perhaps if they offend again, they probably don't come back to your program.
Yeah, and honestly, I don't know, but and partly probably because it's a little too early to tell.
Okay.
This is a newer program for us.
Oh, it is. How old is it?
Maybe a year or two.
Okay,
Yeah.
1 or 2 years.
So we probably don't have enough information yet.
Okay.
In terms of our the sex offender treatment programming, we've done we usually have done 5-year studies, and we look at recidivism, and our recidivism rates for men who complete the sex offender treatment program is actually extremely low. I forget the number, but it's extremely low, and it's lower than the average, than what the average is. So,
is the completion rate low because the bar is set too high?
Oh no, the completion. No, it's if you've completed the program, the likelihood that you commit another
come
sex,
back.
Right, that's
okay.
very low. So
well, that relieves me.
Sorry.
I was going to say,
actually,
what?
Yeah. No. So for men who went all the way through and they successfully completed treatment, those men have extremely low rates of reoffending.
Okay, gotcha.
So
that's more encouraging.
It
and
is.
I thank you for clarifying that. And I'm sorry if I misunderstood that. So medical and legal advocacy. Do you want to take that and give Kim a chance to?
I would love to take that over.
Catch her breath here.
So that's my program.
We provide.
It is. Yep. So there are 6 advocates that work at REACH, and I have around 20 volunteer advocates. And together we are able to provide these services, these advocacy services 24/7, which is really important for the community. Medical and legal are the main areas we work with. We work within the legal and medical systems to ensure survivors that they are supported, they're believed, they're not alone. Okay, so the medical piece is really what we have to provide support for 24/7 because, as you can imagine, sexual assault happens all the time,
Sure.
day or night, right? So sometimes we'll have survivors going into the hospital for a sexual assault forensic exam. Those have been in the news lately with the kits that have been untested. But that's what we're talking about when we're talking about medical advocacy. A survivor will present to a local emergency department. We work primarily here with Aurora. And if it's noon, if it's 5 p.m., if it's 2 a.m., we will have an advocate that's called into the hospital to provide emotional support, information, and resources for that person. Or their family. Sometimes it's a child. We'll work more with the parents. So we'll just be there with them during the exam process, providing that support and encouragement, and letting them know that there's support for them beyond that initial exam.
Sure. And letting them know, too, I would imagine, what some of the next steps are. Because when you're involved in something like that, it has to be frightening.
Absolutely.
You don't know. I mean, first of all, you're already dealing with the fact that this happened to you. You're still in shock probably in some instances. And to be thrust into this whole system, the medical system, the legal system, it's got to be overwhelming, especially for younger people.
Absolutely.
So it's nice that you're there to kind of do some hand-holding and guidance along the way. You talked about 20 volunteer advocates. What kind of training must they go through to be able to be a volunteer advocate in that program?
Yeah, so they train with me. I do individual trainings just because I kind of get them here and there. So nothing done in groups, but I'll meet with the individual. We'll meet for about an hour, talk about just an overview of the program, some of the work that REACH does with the community, with the different systems, and they'll have some reading to do on their own. We'll regroup again, make sure, go over everything. We use materials from the Wisconsin Coalition Against Sexual Assault, which is the state coalition that oversees agencies like REACH that exist in many counties in the state. So we use all of their information to train victim advocates on the dynamics of sexual violence, because of course there's a lot of misconceptions around the issue.
Sure.
So just to make sure that the people we're training as volunteers are aware of some of those misconceptions and they can be corrected if they're there. And then just letting them know a little bit about how the medical system works, how the legal system works, and setting them on their way then.
And then you hope that it works the way you said it's going to work.
Absolutely. Absolutely.
Because some things are clearly out of other people's hands. Personal advocacy. Without even reading the description there, I would assume that is something like your victim coordinator with the DA's office. If you've been the victim of a crime, no matter what it might be, there's someone there to help you as the victim. Is that kind of the same thing?
That would probably fall more into the legal advocacy piece, which I didn't get to when I was explaining medical. But you had said, you had said, at the medical exam, holding the hand and letting them know what the next steps are. And that's kind of where legal advocacy comes in.
Okay.
Because if it's a survivor who's an adult, they can receive medical care without having to report. They can decide down the road if they want to, right? So they go in, they have their kit done, their evidence collected. Now that part's over, they can wait 2 months and decide, okay, you know what, I think I'm ready to talk to the police now. So that's when we would go with them to the station if they would like. If the DA's office picks up that case, we will walk through the court process with them as well. So that's where we collaborate a lot with the DA's office, both with facilitating communication with the prosecutor as well as victim witness. So we kind of provide that wraparound service with the community-based organization, and then the DA's office being part of the system can help guide them with those intricacies of the process.
Okay.
Yeah, so we're working very closely with them. And then personal advocacy would be kind of just, someone who calls and needs support. They're not necessarily looking for an exam. Maybe it's something that happened 10 years ago and they're ready for services. Maybe they want to attend a support group. Maybe they just have stuff they want to talk about. So we'll just provide advocacy one-on-one at that personal level. Like, tell me what's going on and how we can help you process what's come up for you.
Sure.
Yeah, not necessarily engaging any other systems.
So a lot of trauma can come from someone committing suicide. But that's not a service that you guys provide, or is it? Or is that more for another program?
Yeah.
So in terms of the counseling program, sometimes depending on the situation, sometimes it's a very appropriate referral for us. So we do take those sometimes.
Okay, all right.
But you're right. The primary focus of our trauma work is interpersonal violence and the complex trauma Kim mentioned earlier. So something that happened with another person at the hands of another person that they knew, maybe they didn't know, that they trusted, maybe they didn't, but and that happened over a period of time.
Yeah.
So something that was very close to that person's heart.
Okay. And now school-based education, that is, I think, we're going to get into where the trafficker, your trafficking advocate goes into schools and so forth, but it goes a lot more beyond just trafficking. So who wants to talk about that?
Yeah, I can. Well, I'll touch on first the separate programs within advocacy, if that's okay, and then
Sure,
go
yes.
into that. So
Yep, absolutely.
I mentioned I have 6 advocates. I'm the team leader for that program. I just kind of do general advocacy work in the county, but my other advocates at REACH they do the same type of work within medical and legal systems, but they have specialized populations that they work with. So I want to make sure we touch on that for the community
Sure.
so they know what we offer. We have Dina, who is our anti-trafficking advocate, and she works with the DA's office a lot as well on diversion programs to work with women who've been arrested on prostitution charges, just to ensure that they're able to rehabilitate and get what they need rather than having another charge on their record, because that hinders growth, right? That hinders their ability to find work, find housing, all those types of things. And then she'll work with other referrals that she receives from the community. We have a Native American outreach advocate who works with the Native American community in our area. So although it's a relatively low percentage of folks in our community, Native women have the highest rate of sexual violence out of any other group of women or other group of folks. They are victimized at the highest rate. So she does wonderful work. She also does a group down at Techita Correctional Institution for women survivors. I think Native American folks make up 1 or 2% of the population in the state, but they make up 10% of the inmates at Techita, which is
Wow.
a devastating statistic.
That
So they
is.
go down there, and she provides a talking circle for women there. And that's just one of the wonderful things she does. We have a Latino program advocate who works with, again, providing culturally competent and culturally informed services to Latino survivors in our community. They face many barriers, language just being one of them. So she is able to meet them where they're at and provide services, understanding the culture. We have a UW Oshkosh victim advocate who has historically provided services on campus for survivors that are students and faculty and staff. We are in transition with that program right now. She will be coming off of campus. Unfortunately, that position has been replaced by an internal person. So we will no longer be on campus, but she will be working with REACH in an advocacy and a prevention education capacity. And then we also are just wrapping up this project, but it's the Sexual Assault Kit Initiative advocate. So we heard about, the untested rape kits
Yes.
that it was a nationwide epidemic. It's certainly not just a Wisconsin issue. But she is working with a few survivors that had been identified. Their kits were tested now, and she's been working on that initiative, with prosecutors and law enforcement, partnering with the DOJ, and there'll actually be a trial here in Winnebago County at the end of the month for one of the cases that was found and charged from this initiative. So she's been with us for a couple of years, and her term will be up shortly as well.
So we're taping this on September 19th, so at the end of September, that case in Winnebago County will be getting underway. You guys do so much. I mean, I've been listening to you. I've been looking at all the stuff. I've been making notes as quickly as I can. And I'm blown away at everything that you guys do with a relatively small staff.
Yes.
I think in comparison, sure, your staff, okay, you've got 20-some people. But by comparison, look at everything you're doing. And I think it's a very small staff compared to what you're trying to do. So, wow, hats off. Okay, anything else about the advocacy stuff that you think we should touch on, or maybe re-emphasize?
That's a good nutshell. Yeah, we're available 24/7, specialized programming, it's all there.
Okay.
Yep.
All right. Fantastic. So let's talk then about the school-based education, because boy, kids, they're victims just waiting to become victims. I think in some cases, both parents are working. Sometimes they're working multiple jobs. When I was a kid growing up, they were called latchkey kids. Now these kids are home for hours on end. With no parent around, and not in all cases, but in far too many. And you've got social media. There's just so many things that affect kids today. I would not want to be a parent in today's society, and I say that not to frighten the bejesus out of you, but you're 6 weeks away from giving birth to your first child. Our floor director just had his first child a month ago. Well, he didn't, but his girlfriend did. And so, this is a tough world to be bringing kids up in.
It is.
And so that's a lot of what the educators address when they go out into the schools. Like I said, it's K through 12, so they're being very age appropriate when they go out. And with the younger ages, they are talking about things like warning signs. How do I recognize if I feel unsafe or uncomfortable around somebody? And if something does happen, who do I tell?
Yeah.
So oftentimes at those lower grade levels and younger ages, they're getting a lot of disclosures when they go out too, because now they're talking about this and they're creating an environment in which these kids can identify, oh, that happened to me.
That's what that was. Yeah.
That happened to me, and I can tell these people about it. So particularly right now, sometimes this time of year we get busy because school-based education starts, kids begin to disclose. We might get that referral for counseling. So that's one of the ways a lot of our programming can overlap as well.
Right.
Educator can go out, receive a disclosure. I help report, go through court. They see the child therapist. So a lot of times folks can use multiple services at once at Reach.
Okay.
Yeah, so they do, those topics in the lower grade levels. When they get a little older, they're talking more about things like healthy relationships, when kids start to date and start to experiment, as well as things like consent. What is consent? Because it's misunderstood, unfortunately. It seems very black and white, but you need to talk about it. So healthy relationships, consent, what the law is. So all of those more nuanced topics as they get into the older grade levels.
Do you guys find that kids today, and I don't care what age, as kids we all think we know everything, right?
Of course. Yes.
And so do the kids seem to be receptive to what you and your people, your advocates are saying, or are they just sort of, just listening, but not really?
Yeah, I think it's a mixed bag. They do pre and post tests when they go out, so they can kind of measure what their impact is. They've got a lot of, proven ways they reach out to kids by trying to make it entertaining as well.
Sure.
So I think they get some pretty, I think they've got some pretty receptive kids, but you're always going to have...
Oh, yeah. You're always going to have that.
Yeah, you'll always have the
segment
ones that are going to kind of in one ear and out the other, but hopefully they take something from what we're talking about.
Well, even if they can glean one or two things from it.
Yep.
And you hope that it doesn't happen to them down the road when they have a child.
Yes.
But, a lot of times when you're not paying attention, you become victim to something or you commit a crime yourself. And then later on, as an adult, some people just never grow up. I know of a few people who have just never, ever grown up. They're still the same person that they were when they were a teenager. And they're still trying to find ways to circumvent or shortcut the system, and still screwing up at every turn. And that's just so disappointing to see, It's like, come on, you're almost 40. Now get with the program here. So how many folks do you have going into the schools?
We have 2 educators, and they always have a couple of interns helping them out.
Okay, all right. And are you just dealing with schools in Oshkosh? Because you've got an Oshkosh office and you've got one in Neenah.
We do.
So do you cover then all of Winnebago County?
We do.
You do?
Yes, we're
Okay.
in practically every single school in Winnebago County minus a few.
Yeah.
Yeah.
Wow.
Yeah.
That's so you're jumping on this right away, probably at very close
Right.
to the beginning of the school year. And do they make multiple visits to a school within a school year, or
At the upper levels, they do. I'm not
Okay.
sure if they go multiple separate times, but I know they go days in a row
okay. All right.
in the high school level.
So maybe 2 or 3 days in a row,
Yep.
and they're talking to different sets of kids. Okay, and the public education, the public schools, of course. What about the parochial or the private schools? Are they?
I don't know how many we're in, but I know we are in that there are some of the private and parochial schools that do invite our educators to come in. So we're very excited, and we're always very grateful when we're invited into those.
Yeah, because I know of some folks who have their kids in private schools within the Catholic school system in the Oshkosh area, and they don't seem to have. At least those kids don't seem to have some of the problems that kids often do in public schools. Not to give public schools a bad rap, that's not what I'm trying to say, but things, because it's religion and faith-based in the parochial schools, sometimes kids are a little bit more, less apt to fall into things. Or am I putting too much on that?
I think you might be putting a little bit too much on that.
Okay.
I think some people can hide it better.
Yeah.
Okay.
It happens.
Yeah, it happens everywhere. It happens everywhere. It happens in faith-based communities. It happens in public school communities.
All socioeconomic status.
Yeah.
Okay.
That everybody needs this education.
Okay. All right. Well, that's good. And so I'm glad to see, though, that you guys are going in
Right.
to the,
And say
to the
yep, they'll
parochial
go in
schools.
just about anywhere they're invited.
Yep. That's
They
the
will.
truth.
They
And-
really
and
will.
is that the case, that you have to be invited in to go in?
I think
Or-
so. Yeah.
Yeah, I'm not
Okay.
Yeah.
totally sure how they
Generally, I
get into
think
it.
so,
Some of
yes.
these relationships with schools have been here for years.
Sure.
And so at this point, it's just
It's just what we
continue
do.
to come in.
Okay. So if let's just say there's a new school or maybe a new advocate who wants to make themselves known to the schools and so forth, do they contact the school or the school district and say, listen, I'm so-and-so from REACH, I'm new to REACH, I want to come out and introduce myself and maybe talk to the kids. So that's how they make their first contact. But if they've been around, for years with REACH, do they just say, school's starting up now, or now it's after spring break, and can I come in and chat? How does that work?
They have a very coordinated effort at the beginning. It's sometime between the end of the school year and the beginning of the next. One of our educators will attend a meeting of counselors with the school district, and they kind of work out their schedules at that time. So by the time the school year starts, they know where they're going to be and when for the duration of the school year.
Our
Oh,
educators,
really?
Yeah, it's
right,
very
they
coordinated.
are they already have scheduled. I think most of their school
It's
year.
not random at
Holy
all.
cow,
Yeah,
that's-
it's very coordinated.
Wow, I would say so.
Right.
Yeah.
Holy cow. So when summer's wrapping up, they know where they're going to be until next June.
They
Yep.
do. Yep,
Yeah, they really do.
Well, that's nice to know where you're
Right.
at on
Yeah.
any given day, right? Social media. This is a huge thing. It's not something that, I'm going to age myself here. It's not something that I had to deal with when I was in school.
I didn't either.
Me neither,
Okay.
actually.
Oh, okay. So we're all sort of,
We're all there.
We're middle age or older. So at least I'm older. I don't know what it would have been like to have to deal with social media as well as everything else, because
Yeah.
you've got a lot of pressures already put on you. And, when I was a kid growing up, and you guys probably too, we had bullies in the school system, and, but we could get away from it.
Right.
When we got home, we could get away from it. Now you can't get away from it. And kids are constantly on their phones, so they're constantly having that in front of them.
Yeah.
So what is this social media intervention program that you guys have?
Yeah, so that's also through our education program.
Okay.
And it's kind of a way to educate youth, teens in particular, about social media, especially when we're talking about sexting and the distribution or taking of nude photos. Nude photos, inappropriate photos, explicit photos that we're sharing among ourselves, because there's only a couple of options really within the system to handle that. It's either nothing or it's
A felony.
distribution or possession of child pornography, which seems extreme for kids who are just sharing images, right?
That does seem extreme.
Right.
So this is a way for them to gain some education,
Okay.
to not have to,
Have
be
to end up with
arrested,
this felony.
be charged with something.
So this
and
is
they
a
can
diversion
get some
program.
education. It's also a diversion program, yep, just for some youth.
Okay.
So there's a charge for the program. It's about 6 weeks long, and
Okay.
it's been a hit. I mean, there's been other counties that have approached us wanting to learn from
Wanting
Brian,
to duplicate,
who put
wanting
the
to
program
duplicate the
together.
program.
And it's a really great opportunity
Well,
for some
hats off
education.
to you guys. So I guess I knew that certain things were a felony, but I'm not sure that I knew that a boyfriend, or I should say a girlfriend maybe, or a boyfriend, somebody exchanging photos of themselves with their boyfriend, their girlfriend, their partner, whatever you want to call it. I guess I did not realize that rose to the level of being a felony.
If they're underage.
If they're
They're
underage.
considered children.
Yeah.
Yeah.
Well, and in school, most times
Right.
these kids are underage,
It's it's considered child pornography.
even
that's-
though you're sharing it yourself
You're
with someone.
right. So that's the
There's
that's
all-
that's the category it seems to fall
Yeah.
under.
And there's also situations where someone might receive an image and it's from
That's
a
unwanted.
partner that's unwanted, or that's from a partner currently.
Yeah.
Maybe they break up and maybe they distribute that photo to other people.
Yeah.
Right.
So there's a lot of, once it's out there, it's out there.
Yep.
And there's a lot of different things that can happen.
Yep, and just because you have Snapchat and you think it's going to disappear, it doesn't.
It
Like
might-
you
it
said,
might
once
not.
it's out there, it's out there.
It can be grabbed and it can be saved
Yep,
and
yep,
shared
for sure.
without your permission.
Do you see, and of course, things are always up to the discretion of the DA's office, but in a case like that, where it was just something innocent between two kids, do you see them being real heavy-handed in charging them and following through on that?
I don't. And that's part of the reason why we have the diversion program, is so that there's some sort of education.
Okay.
Is that the DA's office, the police, they wanted a third option. They wanted something in between. We do nothing, or we give this
really
kid,
charge this, yeah.
we give this child a heavy charge,
Right.
who perhaps just needs some intervention and some teaching.
Yeah.
Needs to understand the risks and the dangers.
Our kids, and I realize that you two aren't the ones going into the
Right.
schools, but do you think that kids are shocked when they hear that?
I'm sure they
Yeah,
are. Yes,
yeah.
absolutely.
How serious this is?
Yeah.
Yes.
Yeah.
I know the teenagers that I speak to when I'm doing counseling are often very surprised.
Surprised enough that they're scared to not do it, or just shocked and they say, I got to figure out a way to get
Be a
around
little more
this.
careful, yeah.
Right. Yeah. I like to think that it's shocked enough to kind of go, oh, it's like, yeah, that's not really
Yeah.
a good idea, or, but I think, at all levels, I mean, I know the counselors and the educators, we do a lot of talking about social media and how to use that appropriately and safely. That's a big piece of the education program. I know myself and my other, and the therapists on my team, we talk about that a lot with kids.
Well, and while you're talking about it with kids, is anyone talking to the parents about this?
Yes.
Because, thank you. Because here again, I know parents who, they think, well, my kids are good kids. I don't need to pay attention to what they're doing on the internet. Wrong, you do. And you don't know. I mean, you are basically, when you just turn your kid loose on that computer, you're basically leaving your front door to your house wide open.
Right.
And anyone from anywhere in the world can stroll on through. And I mean, look, we didn't even use social media in the Jamie Kloss situation. He saw her standing at a bus stop.
Right.
I mean, this is how bad things can get real quickly in
Right.
today's world. And these parents who don't pay any attention to...
And I think sometimes they don't understand. They don't understand what's out there. They don't understand because there's always something new. And this is one of the
Well,
things, and our educators work really
yeah.
hard actually at staying very on top of all of this stuff about what are the things that kids are most using? How are kids working around you know, the Facebook rules their parents might have. And,
Yeah, yeah.
So, and I think, and whenever possible, I know our educators have at times offered presentations for parents about let's explain some things to you, because we want the parents to be knowledgeable about ways they can learn about the technology that's out there, and also learn about ways like technology that can help them monitor and keep their kids safe while they're learning how to responsibly use the internet and social media.
Yeah, I understand that some parents maybe don't understand.
Right.
They're naive, but then there are some that are just flat out stupid. I'm not even going to call them ignorant, because they've now been told, because I've told some. I've said, you can't just let your kid do this. One took a picture of her driver's license, her new driver's license permit, and put it, you could read it clear as day, put it on Facebook. I realize that's a proud moment for a child and for a parent as well. But I mean, my God, that has all the information right there.
Right.
And, you know, I've said, look, here, I got some materials on how to keep your kids safe on the internet. And the mother didn't even want it because she said...
And that's too bad.
Yeah, it is. She just said,
but it also, it is,
I trust my kids.
Right. But it's also very difficult. This is an incredibly difficult thing to monitor. You know, because I've worked with a lot of families where I've got parents, they're doing all the right things. And let me tell you, some, you know, social media and these are, it's pervasive enough that they find ways around it.
Yeah.
You know, so
That's
this is
very
really,
true.
so
Yeah.
it's very, this is a very challenging thing for families to deal with. Yeah, because it is very easy. I mean, I've met parents, they do all the right things, and it's really, and sometimes there's still problems.
Yeah. Oh, absolutely. But then when you know about it and you still don't want to do anything about it, you're just asking for trouble. And you may or may not get it, but hopefully you won't. But I just, it's not something that you should be taking chances with, I don't think, you know. And so I'm glad that you guys are out there talking to folks and getting things done. We're down to about 8 minutes left in our show. I can't believe that it went that fast. But I know that we've talked about a lot of these different things. Support groups. You mentioned about support groups earlier. And now where do these... It looks like Women Survivors of Sexual Abuse. That group meets in both Oshkosh and Neenah. Native American Talking Circles, they meet at Harbor House, which I've heard of that. Where is that? Appleton, okay. And Christine Domestic Abuse Services here. For Latina women, boy, I don't know Spanish. It looks like
Mujeres Adelante.
Okay, I wasn't
something
even
along those
close.
lines. Yeah, for women who speak Spanish.
Okay.
It's very hard to find good services in your native language sometimes.
Sure.
And so this is one service we can offer for
Sure.
Latina survivors.
And then, of course, LGBTQ plus survivors of violence, and that group meets up in Neenah. On your website, do you have the days or times that these groups
It's
all
best that
meet?
people call.
Okay.
Yeah, because sometimes they change. So we would encourage anybody that's interested in attending a group to just give our office a call and ask for questions on current dates and times.
Okay, perfect. So before we wrap things up, we've got some photos, and we want to kind of show them here a little bit. And I think the first one that we have is probably a photo of your office. Now, I don't know if this, when it comes up, I don't know. There it is. Now, is that here in Oshkosh, or is that the one in Neenah?
That's our
the one in
need.
Neenah.
That's the one in Neenah. And where is it located? What street?
Our Neenah office is 1509 South Commercial Street.
Okay. And how about in Oshkosh? Where are you located here?
In Oshkosh, we're just down County A from our main office in Neenah. We're on Doctor's Court.
Okay.
So we're within an Aurora clinic there, 414 Doctor's Court.
Okay.
So folks can go to the lower level and find us
And
there.
find us there.
Which is right off Bowen Street.
Yes.
Yes, it is.
Okay, good. And so then I think we also have a picture of your logo, and there it is.
Yep.
And I was just reading today, I was wondering why the hummingbird was part of your logo. And tell us real briefly about the hummingbird and why that's such a significant part of who you guys are.
Sure. So we rebranded a few years ago with that new logo, and the hummingbird represents resilience, which we see in a lot of our clients, and we want to encourage and instill in them. So it's a very small bird that overcomes, and it's
They can fly
resilient.
backwards and
Right,
everything.
yeah.
They can fly backwards and everything.
Yeah.
Hummingbirds are amazing.
They are. They are. And if you ever get to Arizona, in Tucson, at the Sonoran Desert Museum, they have an entire aviary of just hummingbirds.
Amazing.
It is amazing. It really is.
I love it.
Okay, so our next photo then, I know we have some. We didn't even
get to
show
that.
this one. Tell us what we're looking at here.
So you're looking at the 10 ACEs. ACEs stands for Adverse Childhood Experiences, and it's a study we use to guide our work at REACH. It's a study that was done in the 90s by the Kaiser Permanente group, and what they did was studied something like 17,000 adults, and
yes.
found correlations between initially just child sexual abuse and physical and mental health issues later in life. So you're looking at what the ACEs are considered. So the different types of abuse and neglect, and then various household dysfunctions children might experience. So those are all considered an ACE. And the higher your ACE score, 1, 2, 3, 4 out of 10, the more likely you are to experience various physical and mental health problems later in life. So what we've actually started doing at REACH the last couple of years is giving the ACE study to all of our adult clients to measure what have you experienced in your life and what are you bringing in with you today. Kim actually started extrapolating that data to compare the REACH averages to the Wisconsin state averages, and I mean, at REACH you're expecting to encounter
To see
people
a
with
higher
trauma
rate.
anyway, but our rates are very high compared to the state average.
Yeah, 60% of our clients have experienced 4 or more of these 10 ACEs.
Wow.
And 4 is significant.
And
because
4 is
they,
significant.
they-
That seems to be a cutoff number where that's a big deal.
Yeah,
in
where
their
it's
research.
a significantly higher risk of early death because of suicide or because of just your
General health.
problems
Right.
because of the trauma you've experienced.
Sure.
So we use that to guide our work and know that a lot of the people we're coming into contact with have a number of these in their history.
Okay, excellent. Let's move on to the next one then. And there we want to talk about Take Back the Night, coming up on Wednesday, October 2nd at Beckett's Restaurant, 2 Jackson Street Avenue in Oshkosh. For people listening to us on the radio, again, that's Wednesday, October 2nd at Beckett's on Jackson Street in Oshkosh. It looks like 5 o'clock is
5 o'clock,
when there's something going on in activities and resource fair. 5:45, there's a survivor speaker and a call to action, and then starting at 6:45 is the march. Did I read that correctly?
You sure did.
Okay.
Yeah.
Wow. The glasses still work. So, and people don't need to sign up for this, right? They can just come.
correct.
Just show
Yep,
up.
They can
Okay.
just show up, and I hope that they do. We're moving it into the community this year in hopes to gather more of the Oshkosh community to Beckett's.
Yeah, and we've got a few photos from the last couple of events, and people can just look at these. And for people listening on the radio, I will you can't see it,
Go
but I will
online,
just tell you that they're just some photos. We can keep scrolling through there. They're just some photos of different things that happen or have happened at the annual Take Back the Night event. So I think we have maybe 1 or 2 more photos that we need to look at. Okay. Yeah, so very good. So, and it looks like that was was that listening to a speaker?
Yes.
Yes.
Okay,
Looks like
all
it.
right. Yeah, it looks like that was a good crowd.
Yes.
And this year you're hoping for even more. So excellent.
Absolutely.
Great.
Very good. In our remaining minute and a half or 2 minutes, any last things that you want folks to know? Actually, we've got less than that.
Yeah,
so-
well, real quick, we talked about volunteer advocates. If people are interested that are listening, they should get in touch with me.
Okay.
Call REACH, ask for Mary Ann. I'd be happy to tell them about our opportunities. Not everyone is up for doing in-person, on-call, overnight stuff, but we have other ways to get people engaged, so
Okay.
please call.
And I hope that we've been putting up the website address throughout the show, but it's reachcounseling.com. So, guys, thanks so much for being here. I
Thank you
appreciate
for
it so
having
much,
us.
and we definitely will have you back again. If anyone out there is in the Oshkosh area and would like to volunteer with us, there's information on your screen right now. For those listening on the radio, you can contact me at ionoshkosh@gmail.com. You need no experience. We will train you. We don't pay you, but you learn a lot. And so what you don't have to put in your wallet is good information to store in your brain. So anyway, thanks again, guys. Appreciate it so
you.
much. Thanks to the crew, as always, and most importantly to you. We'll see you next time. Until then, keep your eye on us. We've got our eye on Oshkosh.